have our renowned endocrinologist Dr. Anantarapu Sailaja with us in our talk show. Ma'am, before we proceed with our talk show, we would like to have a brief introduction about yourself to our viewers.
Hi viewers, I am Dr. Sailaja and I am the endocrinologist who is working in Tirupati, Andhra Pradesh. Actually, I am the first endocrinologist in Tirupati and I practice there for the last 10 years and I am working in Tirumala Hospital, Tirupati. Thank you.
Thank you, doctor. And once a person is diagnosed with diabetes, are they immediately put on to treatment?
No, definitely not. If we check the sugars with the GTT, that is a glucose tolerance test, and along that includes the fasting sugar, where we check the fasting sugar followed by 2 hours after we check the post glucose blood sugars. If the diabetes is being confirmed, then we initially advise the patient to go for physical activity, lose weight for almost 5%, and diet restrictions like avoid high carb diets and high fat diets, and go for regular walking and all. And still if the sugars are not under control, it is always advisable to start on anti-diabetic drugs. But if the sugars are quite elevated, like if the fasting sugars are more than 150 and all, then it is no point advising only the physical activities. Such patients, they should be advised physical activity along with the anti-diabetic drug prescription.
Thank you, doctor. Does it mean, does exercise or yoga help in controlling the diabetes?
Definitely, I would say in initial stages of diabetes, the patient should be more emphasized upon taking the physical activity and the yoga if possible for the elderly people who cannot go for the brisk walk, and patients who are on like if they are having any osteoarthritis and all, they cannot go for brisk walk and all. For such patients, it is always advisable to go for simple yoga techniques along with the pranayama and all. But definitely physical activity involves the regular brisk walk for almost 15 to 20 minutes, 5 days a week, definitely will make an edge for any diabetic patient along with the prescription of anti-diabetic drugs, because definitely by losing weight by 5%, it adds up for the diabetic patients in regulating the sugars along with the anti-diabetic drugs. So, physical activity, exercise or yoga definitely have an edge have a role in any diabetic management along with the drugs.
Thank you, doctor, for your valuable advice to our viewers. Definitely, I am sure that our viewers will benefit from this. And for more information about diabetes and its management, do log on to our page Diabetes Per Church on Facebook. We are also available on Instagram, Twitter and YouTube. Stay connected. Thank you.
Thank you all.